You've probably heard the term growing pains, or maybe you've even experienced growing pains if you can think back to when you were a child. But what are growing pains exactly?
That's right. Pediatric emergency physician Dr. Patrick Mularoni joins us with some information about this childhood condition. Welcome back. Always love our conversations. I've chalked a pain up to this. I mean, just Alex asked me not too long ago, Mom, I have a pain in my leg. I don't really know if it is, but I say it's growing pains. Yeah, is this legit?
Well, it's not a medical term. And we all use it as like, oh, growing pains, it's a medical condition. And truth be told, we really as physicians don't know what it is. There's multiple papers, like 150 papers on growing pains, and they have no consensus. What we describe as growing pains, or what should be described as growing pains, is a child, 3 to 12, but mostly like 8 to 12, who has muscle pain, usually at night or in the middle of the night.
Yes.
That pain is something that you can rub. And it's usually bilateral, meaning that both legs are affected or both arms are affected. But that's essentially what growing pains are. The problem is that a lot of parents chalk up other problems to growing pains. And the one thing that's most interesting, it doesn't occur during peak growth. So growing pains happen when you're younger, not when you're growing the most in the beginning of puberty.
Interesting. That's right. That is. I do remember some growing pains in puberty. I feel like I do. I don't know. Anyhow, my daughter, my youngest one, my 5-year-old, she complains of them at night, and if I grab her leg and hold it, she says the pain goes away.
And that's reassuring.
Okay.
That's reassuring. We have other problems that we see a lot in kids that are in that age range as well, that parents might call growing pains, but they're not. If your child's having a pain when they're active, so let's say that they're playing a sport and they're complaining of it while they're playing the sport, that's not growing pains. Something else is going on. 2 of those I want to talk to you guys about. Okay. The first one, most common, Osgood-Schlatter, named after doctors Osgood and Schlatter. At the place where your quad, patellar tendon inserts into your leg, so right where that tendon inserts, you can get inflammation there in young growing children because of the way their bones are growing. That's called Osgood-Schlatter. You can push right there and it hurts, okay? That's one of the places. The second one that we see a ton of is called Seaver's disease. It's called Seaver's disease, sounds scary, but it's really the same thing, but it's the calf muscle where the Achilles tendon inserts into the back of the foot, and kids will have inflammation there as well. The good thing about Osgood-Schlatter is you can play through it, and the treatment is really ice and rest. Seaver's disease, the thing you're going to want to do as a parent, if your child has heel pain when they're playing sports, especially those soccer sports or cleated sports, put a silicone heel cup into their shoe, something that pads them. You can buy silicone heel cups online, and it's for that condition, it's really good.
Wow. Again, so it has nothing to do with actually growing. And so maybe, is there a way to test, or when do you think you're just chalking up to the old wives' tale now of growing pains versus coming in and seeing you?
Well, I think that there's a couple warning signs that you need to think about. If your child's waking up in the middle of the night and complaining with pain in one place, and it's the same place over and over again, you should be concerned, because growing pains, the ones we talked about earlier, both legs, both arms.
Bilateral.
But if it's just in one spot, they're always complaining of their left knee, or they're always complaining of their right thigh, and it doesn't feel better when you rub it, you should be concerned. The second thing is if they're having fever. If they're having fever and complaining of one area, absolutely that's something that you should be concerned about. Obviously, if you get the flu, your whole body might hurt. That's different, right? This is if they're pointing to one place and it's 3 nights in a row and it's like, gosh, they keep talking about their left knee, you got to get in.
You have to look. Okay,
good one.
Well, we just love having you as a resource personally, so we know our viewers do too. Thank you so much always for helping us.
Thank you.